Hi, good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. Today, we have important updates on COVID-19 vaccine, the antibody treatments, and data within the city from our panelists, Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. So let's get started with Catherine Wells.
Good morning, everyone. I want to start off by saying happy Thanksgiving. I hope everyone has a joyous and safe holiday. I also want to ask that we be mindful as we celebrate the holiday. Our surge in cases is not due to super spreader events, but it's the accumulation of thousands of decisions that are made across the community to ignore public health guidance of wearing a mask, staying home when we are sick, and keeping physically distant. As we go to celebrate our holiday, we need to keep these public health guidance in mind, and please follow these 3 important steps. Today, we are likely to cross the threshold of 30,000 cases in Lubbock. We have also exceeded 300 deaths, and our thoughts and prayers go to those families who have lost a loved one. We continue to see 500 cases a day, and we need to make sure that the decisions that we make through the holidays don't do anything to increase the number of daily cases that we continue to see. Although our cases have not subsided, we do have some positive news. We do have some chances to bring this virus under control, and that is through vaccinations. We have gotten some very promising data from some of the drug manufacturers showing that the vaccine is very effective. Over the last few months, the health department has been working with our state and federal partners to plan for vaccine distribution in our community. We already have 48 different entities signed up to be vaccine distributors. The first vaccines that are going to come to Lubbock are going to be for our healthcare workers. It's so important that we keep our healthcare workers in our hospitals, in our doctor's offices, so they can take care of those who are the sickest among us. The next group of individuals that will be able to be vaccinated are those in any congregate living center, so people that are in our nursing homes, group homes. We want to get them vaccinated because they're some of our most vulnerable. And then from there, we will see a lot more vaccine available in our community through doctors' offices, pharmacies, our community clinics, and then our health department will be out in the community with drive-through or pop-up clinics. We really want to make sure that we target areas or people in the community that don't have access through other providers. Our goal is to get as many people vaccinated as quickly as possible so that we really can truly stop the spread of COVID-19 in our community. With that, I'll go ahead and pass it over to Dr. Ron Cook.
Thank you, Catherine. Appreciate that. You may have heard that the governor has given Lubbock and the Lubbock community about 300 doses of this new antibody drug called bamlanivimab. Let's call it BMAB for short. It's a lot easier to say. And this drug has been approved under the emergency use authorization from the Federal Drug Administration to improve the course of the disease of COVID. Its whole purpose is to slow down the process, and Governor Abbott has given it to us so that we can slow down the disease, and those people that receive it can continue to heal so that they're not admitted to the hospital. The governor is well aware of our urgent situation here in Lubbock, that our hospitals are full, our ICUs are full, our emergency rooms are full, and there's absolutely just relatively no beds that are available. You saw a few days ago that we were short minus 25, and then we were at 0 beds. Last night we had about 5 beds available. I expect this to continue to go up and down and undulate as this virus continues. So the whole purpose of this drug is to give it to people who are eligible, and there's very strict criteria to be able to receive this drug, and I'll go over those in just a moment. But we give it to those people that are not in the hospital, who have a positive test, who are at risk for hospitalization. And if we give them this drug, the early studies show that we could potentially prevent them from being admitted to the hospital. That's the whole purpose of the drug. So let's talk a little bit about the stringent criteria that are set aside for those individuals to be eligible to receive the drug. Obviously, first of all, you must have a positive test, and that test must have been turned or positive in the last 5 days. You must have moderate disease, so significant symptoms from the disease, and you must be high risk for hospitalization. And those high risk disease processes include, you got to be greater than 65 years old. Your body mass index must be greater than 35. To give you an idea of what that is, so I'm 5'11", between 5'11" and 6 feet tall. So for my BMI to be 35, I would need to weigh between somewhere 250 to 270 pounds. So for an average guy that's 5'11" to 6 feet, 250 to 270 pounds. You must have uncontrolled diabetes, you must have severe kidney disease, and you must be immunosuppressed, either taking chemotherapeutic agents for anti-cancer drugs or anti-rejection drugs if you have some kind of organ transplant. Those are the criteria that we use. You don't have to meet all of those, but at least some of those, and you'll be put in a rank order list and a triage list to determine who should get the 300 doses first. If you're picked, it takes about 3 hours to do the whole process. By the time we get you registered, it takes about an hour to infuse the drug, and then we need to monitor you for about an hour after that to make sure that you don't have any side effects. And then we will have some follow-up with you after the infusion of the drug. If you're interested and you think you might qualify, please talk to your primary care physician or your primary care provider, and then they can refer you into the triage system. We'll have your primary care provider can either call UMC, University Medical Center, or Covenant if you're part of those two systems. If you're not, then have your primary care provider call the health department. We'll have those numbers up, and we'll have more information up on the health department website by the close of business tomorrow for sure. We're still working through this triage system and who's eligible, and we'll work through that and get that information out to you. I want to change subjects a little bit, continuing what Catherine said about how, pardon me, how our Thanksgiving needs to look a little bit different this year. Our groups need to be smaller, it needs to be socially distanced, and it needs to be among those people who are living in your household. So let me give you an example. In Canada, they had their Thanksgiving about 6 weeks ago. What happened was, about 2 weeks after Thanksgiving, they saw a significant increase in the number of COVID cases in their health system about 2 weeks after their Thanksgiving. We can't afford to have that happen here. Our hospitals, our emergency rooms, and our ICUs are saturated. We cannot tolerate and handle any increase in the cases than we already have coming in. And the way you do that is you have small numbers, less than 10 ideally, you socially distance by household, and you do lots of hand sanitizing and wearing a face mask when you're not eating. Let me give you an example. So in our family, we're going to do this. There's about 10 of us. We're going to set up the food in the garage. We're going to isolate ourselves and we're going to be eating outside. We're going to isolate ourselves by family units that live together. So our boys are married. They'll have their spouses socially distanced, but with, further than 6 feet apart. They'll be wearing masks when they're not eating. And so every family unit will be separated. And so the other thing that we're going to have is we'll each serve our own selves individually at the buffet table. There'll be a hand sanitizer, and you'll go up and you'll do it one at a time. You'll serve yourself and you'll go back, sit down with your family unit that you live under the same house, under the same roof with. And then the next person will do that. And then if you go up for seconds, you go up individually, sanitize your hands again, and go down the buffet line. Well, I plan to stop at the dessert line at least 3 times. I just love dessert. I love all things Thanksgiving, especially dessert. So that's how we're going to do it. I think it's easy to do that. We'll be socially distanced. The weather is going to be gorgeous outside, according to the weather forecasters. So think differently how you might do. You still have 2 days to make this work, and make sure that it's safe for everybody. So I just want you to hear that, yes, we're in trouble. Yes, we can do this if we socially distance, if we wear our masks, if we stay in small groups, and if we sanitize our hands. We can do this. I want to say lastly, blessings to everybody. I want you to have a wonderful but different Thanksgiving. It's going to be just fine. This too shall pass. It's 2020. This is how it's going to work. And I especially want to give an extra measure of blessings, especially to those that have lost loved ones during this time. It's been a terrible time of year. Blessings to all. Let me hand this off to Mayor Pope.
Thank you, Dr. Cook. Good morning, everyone. It's good to be with you again this morning. I want to start with some data slides. Let me share my screen. Okay, so the slides you'll see today are the ones you're used to seeing, plus a brand new slide that we'll show last. So our positivity rate, although still too high, is trending down and has moderated. We won't see significant changes in this until we are able to really curb the spread of the virus, and something we've been talking about. Hospitalized patients, nearly identical to where we were a week ago. This is not a good situation. However, we seem to have found a range that we are, over the last 10 days or so, that we're operating in. Hopefully, with some of the efforts we're taking, we can start to see this go down. Case status, this is would be our school age kids. You can see that very similar to where we were last week. Next would be our sort of 18 to 25 college and young adult. You see a little bit of a bump in the number of active cases this week. Last 14 days, where have our positive cases come from? A little bit of an increase in the 18 to 25 if you were to compare this to last week. Still a lot of cases between 30 and 49. Frankly, with 50 to 69 is not that far behind. And finally, a hospital bed slide that's new. The green line represents open beds, the blue line, those patients waiting for those beds, and then yellow would be the open beds, remaining beds. And if it's above the line like it was last night where we had 5 beds, that's good. If you see, we've had several situations where it's below the line, and we have people waiting in the emergency departments of UMC or Covenant for a bed as it becomes available. This data is available on our city website. Go to the health department and then the COVID data files. It's updated every day about 5 o'clock. Okay, a few more comments. We had a special city council meeting yesterday for the expressed purpose of updating the council and the community on our response to the pandemic. Since we last updated you Wednesday of last week, we've taken a number of facilities. I mentioned at that time that we would be closing and changing the way we're operating city facilities. We made those announcements late last week. I've had a chance to talk to Texas Tech leadership, specifically about their athletic events. You've seen those announcements. Tech football has 1 remaining home game in December. There will be no tailgating at that game. Basketball begins this week. And for men and women's games, face coverings will be required inside United Supermarkets arena. In fact, it's such that if someone chooses not to comply, that they'll be asked not to come back to games for the balance of the year. That's how seriously Tech is going to take it. I had a chance to talk to all of our school superintendents last week, Lubbock ISD, Lubbock Cooper, and Friendship. We talked about the overall efforts and how it's going. And we focused, however, on indoor gatherings, sports, fine arts. And they all agreed, and that frankly, most of this was in place already, that they're going to continue to limit gatherings, dole out a certain number of tickets per participant, in some cases reduce the amounts that had been offered previously, and to require face coverings at their basketball games, at the swim meets, anywhere inside, that's going to be required. I had a chance to talk to the operators, the leaders of both United Supermarkets and HEB, as well as our big box operators. And I think I could summarize their comments with a few points. First of all, in many cases, they're already metering their occupancy. That is, that they're allowing fewer people in the stores than they can allow by order. They're concerned about providing a safe environment for their employees and for you and me as we shop in those stores. They're thankful for the compliance on the whole of our citizens. And I think they're frustrated a bit at those citizens who choose not to comply. You'll see that a number of them are now in busy times offering masks at the door when you enter, and encouraging folks that come in without a face covering to please mask up. We also had a chance late last week to talk to our indoor private athletic venues, specifically the ownership of Premier and Apex, where we have a lot of youth athletics this time of year, both league play as well as the tournament play. They're a great partner. They too are limiting attendance, maybe even a little tighter than the school districts, and requiring face covering. So we're thankful for that. It was good to have the governor and his team here last week. And as Dr. Cook talked about the Eli Lilly antibody drug, we're thankful for that. It should keep people out of the hospital. And that's the goal with that. We got a larger portion of the first week's supply because of the situation that our hospitals are in. And we're thankful for that. It's important to remind everybody that we continue to implement the governor's order to the T of the law. We will make decisions based on facts, not on fear. We'll remain flexible, and we will stay the course with our effort. So as I wrap up, I remain grateful for our healthcare workers, for our hospitals, for our first responders, for the folks that provide our food, whether in our grocery stores or in our restaurants. Thank you. Thank you to you and to your families. We know the sacrifices you make. I also want to express my sympathy for those of you who have lost loved ones and have lost jobs. You're never off of our minds. I'm thankful for all Lubbockites. I'm thankful for your spirit, for your attitude, for your willingness to adjust. I want everyone to please be careful, to stay safe, and to be hopeful. Happy Thanksgiving. Lacey, back to you.
Thank you, Mayor. We're going to open it up for media questions now, and our media asking order today is the Avalanche Journal KMAC, KCBD, El Editor, KLBK, Latino Lubbock, The Daily Toreador, Texas Tech Public Media, and Fox 34. So let's start with Jamie Lozano from the Avalanche Journal.
Hey everyone, can y'all hear me okay?
Yes.
We can.
Perfect. Okay, so my question is just maybe for Dr. Cook or for Catherine Wells. We have seen our death count this month be going up pretty consistently over the last few weeks. Is there a particular reason as to why that's happening, or are these more severe cases like what we were seeing at the start of the pandemic?
I think I can answer that, Jamie. It's just a matter of pure numbers. Since we're seeing a significant number of positive cases, and then the spread within the community hits those very at-risk patient populations. And when they do, it can be certainly devastating. So I think it has to do with just the pure number of total number of positive cases. As we see that number go up, we expect the number of deaths to go up, unfortunately.
But that's all I had. Thank y'all.
Thanks, Jamie.
Okay, thank you. Now we have Laura Lawhead with KMAC News.
Hi, everyone. Good morning. My first question is regarding the vaccines. So, this is the big news of the moment. And when the vaccine is released and made available to citizens in Lubbock, some of our viewers have said that they're a little scared, or they will refuse to get it. So what is your message to the people of Lubbock who might be a little hesitant when this vaccine comes out?
Dr. Cook, you want to take that?
Yeah, thanks, Laura. Just reassurance. There'll be, before it goes, it's going to go out in phases. So there'll be frontline workers and healthcare workers and first responders, and then those that are high risk for severe disease again. So those are all in different phases before it comes out to the rest of the public. I think we'll have enough evidence by that time to show that it's a safe drug. And so those of us that are on the front line, we're going to step up and take it and move forward with it. And I know a number of people are anxious about it, but I think we'll have enough evidence by that time for people to be rest assured that it's a good drug.
Thank you, Dr. Cook. And one follow-up question, speaking of treatments and antibody treatments, with BMAB here, I love that. Do you anticipate, we know that Covenant will be using their tent for experimental treatments, but do you anticipate more tents being needed to treat patients both outside of Covenant and UMC?
Perhaps. We don't know for sure. It depends on trying to get infusion centers set up and different options for that. Right now, we just have the 300 doses in the region, and we believe that more doses are coming, and we'll cross that bridge right now. University Medical Center also has the Ambus, that big mobile, it's a big mobile ambulance where they can handle a number of patients at any given time for this infusion process. And like you said, Covenant is using one of their tent for this infusion process.
Thank you very much.
You bet.
We now move to Karen McKay with KCBD. Karen, can you unmute, please? Karen, are you there? Okay, we'll come back to Karen in just a second. Now we'll move on to Olga Guerrero with El Editor. Olga, can you unmute, please?
Yeah, can y'all hear me?
Yes, ma'am.
Okay, qué bueno, qué bueno. Okay, blessings to all, just in case I forget to tell you at the end. And I hope that everybody has a safe and prosperous Thanksgiving. to be thankful for everything that we have, and sometimes we take things for granted and we don't realize what we have until it's not here anymore. And here recently we've had a lot of deaths, and sadly there was a majority of them that we personally knew, and it's very heartbreaking. But our condolences to everyone, and to everyone that is going through the process of having COVID and experiencing what they're experiencing with their health. Okay, with that being said, the limit for that product, so help me understand, when do you get this vaccine? Like when, because there's a lot of hard cases right now that I'm aware of, and there's some of them that are in the hospital, but they're real close into getting into the ventilator. Or when is it that you know that you are qualified, and when do you get this vaccine?
So Olga, I think you're talking about the bamlanivimab, the drug, BMAB drug, not the vaccine.
Okay.
And so it's an antibody cocktail, and so those people that have those criteria, so greater than age of 65, you're positive, you have moderate disease, you're at high risk for hospitalization, you have uncontrolled diabetes, you have severe kidney disease, or you're immunocompromised and some other reason taking an anti-cancer drug. So if you fit into that category, please talk to your physician or healthcare provider that did the test for you, and ask them if you qualify.
Okay. All right. And it wasn't for me personally, but yes, I will also take advantage of that. You did say cancer patients as well, right?
If they're on a chemotherapeutic agent, an anti-cancer drug, but
Okay.
it's not just one of those criteria. It's and we, because right now the supply is limited. We expect more, but the supply is limited. So we must give it to those that have more of those criteria, that are at greater risk for going into the hospital if they don't get their symptoms improved or the disease process improved.
Okay. Thank you. Mayor, now that you have seen and y'all made things possible to run smoothly and everything with the different entities such as Texas Tech, Wayland, and so on, is there anything maybe to be considered or being part of the path for LISD? Because I know that there has been some cases on there. Is that going to change any in that area?
Olga, good morning. First of all, I think as you're aware, Lubbock ISD is under the direction of the school board and their leadership. Although we talk to them on I'd say nearly a daily basis, we don't have responsibility for the decisions they make. I've said before, and I'll say again, I think our kids need to be in school. I think they are safest there. And most importantly, they don't get behind. And the learning challenges that have gone along with the last 8 months are significant. So I continue to support our schools and their efforts to stay open and to deliver learning in person.
Okay, thank you. Since everybody's going to be staying home for Thanksgiving, try not to eat too much. You know how that goes. Happy Thanksgiving.
Thank you.
More dessert.
Thank you, Olga. Now we go to Karen McKay with KCBD.
Good morning. Can you hear me now?
Yes, ma'am.
Sorry about that. My first question is to Catherine. Catherine, with 500 new cases a day, is contact tracing at this point really a futile effort?
It's not a futile effort in that the education, making sure people understand they're positive, and still reaching out to those direct contacts is important. But again, contact tracing is only one piece of the puzzle of protecting our community. We need everybody else to work on the masking, the distancing, the staying home when you're sick. We can't depend wholeheartedly on contact tracing.
All right. And I also want to ask this to Dr. Cook. last week you said that we were very close to running out of morgue space. Now this week, on the news, we've shown horrible pictures from El Paso of the National Guard coming in, and they're trying to help move bodies and find space there. So for Lubbock, can you be more specific about our situation here and tell us exactly how close we are to calling in mobile morgues?
I haven't, Karen, I haven't got the latest update on the morgue situation. I know that we have made some significant efforts to improve space in those areas. I will tell you that I got a text this morning from one of the hospitals that said they were almost out of ICU beds again, even though last night they said they had a positive 5 beds available between the 2 hospitals. Think about that, 5 beds total between the 2 hospitals. Before that, the day before that, it was 0. The day before that, I think it was a negative 25 beds. And literally, we are pushing patients out as soon as we think they're safe enough to go home. And most COVID hospitalized patients will be in the hospital about a week minimum, plus or minus several days. But those are the ones that we don't go to the ICU. So we're still in trouble. We're still in trouble. All the more reason to make sure that we have a very safe Thanksgiving, Karen.
But Dr. Cook,
Karen, let me answer I got an update on the morgue capacity this morning. So,
all right, thank you.
We have room in our morgues. We are not close to a capacity situation. In fact, there was a mobile morgue trailer parked in Lubbock if we needed it that has been dispatched today to El Paso. So just to show a little bit of proof that we're in decent shape. Not to go against anything that Dr. Cook was just talking about the hospitals, but specifically to the morgue. That's the up-to-date data.
Great. Thank you, Mayor.
Thank you, Karen. Now we have Terry Furman with KLBK.
Good morning, everybody. COVID is bad. I know a few of us that are on this call have had it, and it sucks. So let's talk about the fact that even if you do everything right, you can still get it. And when are we looking at Lubbock being back to, as some people would say, normal? I know people are fatigued with being tired of the virus. Everyone is sick of it. What's the forecast to when we will be back to some sort of normalcy?
I don't think we could answer that question, Terry. I think we believe as the vaccine becomes more available, let's say mid to late first quarter, into the second quarter, that things begin to be a little more recognizable. But you couldn't get me to predict a date right now.
Okay. My second question is this. I know that, okay, so we had 5 beds available when we're talking about hospitalization capacity. We've had a lot of people that are going to hospitals that have been, where are we putting the excess people? Are they in the tents? How soon are they being taken care of? What's the status of that?
Well, Terry, I think, anytime a patient comes into the emergency room, they're always triaged on the acuity of how bad their current situation is. And somebody with a minor laceration is going to have to maybe wait hours while we take care of the most acute patients that arrive in each of our hospitals. So what happens is we look at the number of patients. So those patients that are housed in the emergency room waiting for beds on the floor, we do our best to try to move those patients out efficiently, make arrangements for those patients to receive home oxygen, if they need antibiotics, to receive antibiotics outpatient. But the level of acuity of those patients, we're trying to move those patients out as efficiently as possible and still being safe while continuing to meet the demand that comes from the emergency room. It's a daily struggle. It's a daily battle trying to make sure that that we're taking care of the patients that come in through the emergency room, taking care of the patients that are on the floor, and trying to move patients out of the hospital in a safe but effective manner so they can still go home and be safe. It's a constant battle. And the only way to win this battle is to slow the influx. We have to slow the number of patients coming in with positive COVID disease. And that's one where this drug is going to help, we hope. And the only other measures that we have currently until the vaccine arrives are those physical barriers that all of us continue to talk about: facial covering, social distancing, and hand washing, and recognizing that we need to take care of other people other than ourselves, and by practicing all of those things that we just talked about.
Very good. Well, Dr. Cook, to all the staff and in the hospitals, frontline workers, nurses, people that work the desk, thank you all for what you do. I cannot even imagine the chaos in the hospitals right now, but thank you and happy Thanksgiving to all of you.
Thanks, Terry.
Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Again, I hope that you are having a very safe day. I know that everyone deserves a break over the holidays, but there is a little bit of concern that testing sites are going to be closed for 4 days, especially at a time that there's going to be likely for those to gather and go against the CDC recommendations not to gather. So is there any backups, any other sites that people should be aware of if they need to get some testing?
The testing from the Texas Department of Emergency Management will be closed on Thursday and Friday. They will not be open. They are rarely open on the weekends. That still allows people to access testing through various urgent care clinics and other clinics that are open. The important thing is, if you're sick and you think you have COVID symptoms, even if you can't get tested, you still need to stay home. You still have that exposure or possible exposure. So really, even if you can't get tested, please follow those other guidelines. Stay home, wear your mask, don't go to work until you can get that test on Monday.
Sadly, Catherine, not everyone's listening to the part about not going to work if they're sick. I do have another question for you, and this, Dr. Cook, this is your question. I think it's an important one. I've had people make excuses or say that, they still had family members that got sick and they were wearing a mask. I mean, is that actually possible? And I mean, I know that there's different types of masks that prevent, but can you just touch a little bit on that? Because that's become now one of the excuses for folks not wearing masks.
Well, yes. You can also run your car without an air filter, and your car is going to break down sooner, especially living out here in West Texas with all the dirt.
Mm-hmm.
It's not an absolute. It does slow it down. It does help protect. We talked about the different kinds of masks and how some are better than others. It also, we can get it from not having, in the hospital, we wear facial coverings and eye coverings when we're around COVID patients, because it can get into any mucous membrane. So eyes, mouth, nose, and then, how often are we washing our hands and, that sort of thing. Oh yeah, there's no absolute. We just know that it certainly improves your chances if you wear a mask that you won't get the disease.
So should they wear an eye shield too if they're going to be doing these gatherings?
We can all put ourselves in plastic bubbles, but I don't think so. Yes, the absolute answer to that is probably yes, but I don't think that's realistic. It's about, wearing a mask, staying away from people, washing your hands frequently, and keeping your social distance, and only being in those groups, ideally, who live in your house and that that are not positive and are abiding by the same rules that you are.
Thank you so much. Y'all have a very blessed and safe Thanksgiving.
Thank you, Christy.
Thank you, Christy. Now we have Mateo Rosales with the Daily Toreador.
Good morning. My first question is for Dr. Cook or Ms. Catherine Wells. Are we expected to see a decline in cases from the 400, 500 cases we get a day when college students go home for the semester and when students start leaving school for winter break?
Well, Matea, theoretically a little bit. I don't think it's going to make a huge number of difference because right now our COVID spread is literally everywhere in small groups. And so it's everywhere. And I think these students going home, I think it will help some, but not to the extent that it's going to make everything all better. It's everywhere.
Okay. And my last question is, as you were talking about, we only have 300 of dosage of the drug that you talked about. When are we expected to get some more?
Not sure. That's a good question, Mateo. Not sure. Perhaps soon. It's my understanding we might get weekly allotments, but that we'll have to wait and see what we hear from the governor's office.
Thank you so much.
Okay, now we go to Sarah Self-Walbrook with Texas Tech Public Media.
Hello, everyone. My first question, our healthcare workers and vulnerable citizens are rightfully the first in line to get a vaccine. Do we have any rough idea of when that could be available for the general public yet?
No, I don't think we can quite quantify that. We thought we might have some vaccine late the first week in December. It looks like now it's probably that second week before we'll see the very, very beginnings of it. So much of that so much of the answer to your question will be based upon the supply and how quickly they can get a supply. I think with the news from AstraZeneca yesterday, we now have 3 viable vaccine alternatives that are drawing near. I think that's good news. Theirs is easier to produce and distribute and store, which I think is probably even better news. So that'll continue. Maybe a month from now we'll be able to better answer that question, but today it's just there's too many variables out there.
Sure, understood. And then my second question, the Lubbock Trauma Service Region has been at the state set threshold to be considered an area with high hospitalizations for over a month now. As we all know, this triggered reopening rollbacks. We're seeing several other regions in the state nearing this mark. What have we learned over the past month being under these restrictions? And do y'all think it's made any difference?
Well, I'll start because I have to pull the data this morning. The city manager and I talked about it this morning, and I'll let Dr. Cook and Catherine add if they'd like. So we're at about 27% on the state's rating or percent of patients, COVID patients as a percentage of total patients. Trauma Service Area A, which is Amarillo, is about 40%. Their number is continuing to edge up. Ours is, as we talked about earlier, has sort of found a range where it's sort of not moving much. El Paso is about 38%. They've gone down a little bit. The Permian Basin hit 7 days above 15% yesterday. They're at about 18%, or were yesterday afternoon. And Laredo's around about like we are, 26%, and their number seems to have stabilized in that area. I think we've learned that it requires an all-in effort to keep our hospitals available. I think we've learned that we're taking emergency efforts that we hoped we wouldn't have to take. Good example of that is the mobile medical units that are now installed at both UMC and Covenant. And I hope that we'll learn to slow the spread, and we'll learn that these antibody drugs, both the Eli Lilly drug, which we have, and the Regeneron drug, which we expect, will help keep people out of the hospital and take a little pressure off of those medical facilities. Ron, Catherine, you want to add anything to that?
I think that's a great answer. I don't have anything to add to that.
Okay, good deal. Thank y'all. Happy Thanksgiving.
Thanks, Sarah.
Thank you, Sarah. And now we have Blair Sable with Fox 34.
Hi, all. I'll try to be quick. I know I'm the last one. My first question is for Dr. Cook. So I want to go back to that example that you gave on Canadian Thanksgiving, which happened a little over a month ago. So you said that there was an increase in cases 2 weeks after they celebrated their holiday. So I know that we have been giving these recommendations to families to not have large gatherings, to follow CDC guidelines, but of course, I'm sure we're expecting that people will ignore those guidelines. So what if we do see more cases 2 weeks from now? What if we do see another surge past the breaking point, especially with our surrounding communities, Amarillo, the Permian Basin, El Paso, all without hospital capacity? What then happens to our patients, to the people who need to be in hospitals?
Claire, we'll continue to serve our patient population as best we can. We can also continue our conversations with Austin and the governor in Texas Department of Emergency Management to help facilitate that care if needed. You know, we're West Texas Strong and we can do lots of things, and I think we can handle it, but I'd just assume that we don't go there. We'll be as ready and capable as possible, but we'll do our best.
Sure, thank you. And my next question is just a clarification, and then I have a follow-up. So I don't know if you want to pull up the data slides again, but I wanted to clarify that the current 14-day average for the positivity rate is above 20% at this point. Is that correct?
That's correct, yes.
Okay, so I just wanted to make sure that was correct just based on reading the slide. And my next question is for you, Mayor Pope. So last week, the governor, he visited town. He announced the distribution of bamlanivimab, which is excellent. It's great to hear that we have better care for people who are sick with the virus. He did say that he believes that local entities have enough tools in their toolbox to enforce restrictions that will prevent the spread. Do you agree that Lubbock is doing everything it can to prevent the spread and the rate of infection in our city?
I believe from a city effort, a public health effort, hospital effort, we are doing everything we can do. I do believe that we have some citizens, few citizens, and a number of visitors that often find their way here on the weekends that have a hard time understanding the significance of the situation we're in. But I think the governor summed it up very well.
Is there anything that you think that the city should be doing more of to, I mean, you say that these are visitors that aren't following the rules, to get the message across that they need to be wearing the masks, that they need to be socially distancing and following the rules?
Well, we'll continue to both communicate and educate our citizens and the region. We'll work with our business owners to help their efforts as those visitors to our community find their way into our stores. I do feel like as the reality of the situation we're in becomes a little more real to more and more people, that we're seeing a bit more compliance. I think the cold weather will help a little bit with that too, Blair. I think people don't mind having something over their face when it's cooler. But we're asking our citizens, as we have since the spring, to first and foremost protect themselves, and then to take efforts to protect their family, their neighbors, and the entire community.
Okay, thank you. Happy Thanksgiving.
Thanks, Blair.
Thank you, Blair. This concludes our news conference. And thank you to our panelists and to our interpreter, and thank you all for joining us. Remember, all COVID-19 information can be found at mylubbock.us/COVID-19. We hope you have a wonderful Thanksgiving, and we'll see you back here next week.